Good afternoon, everyone. I am pleased to join Minister Shandro and Dr. Hinshaw today to share more details about the rapid testing pilot for schools. I'm proud that our re-entry plan has allowed students to return safely to in-school learning. Our announcement today strengthens our commitment to safely continue in-person learning. We are launching the pilot for schools experiencing outbreaks starting as early as next week. A testing team will be set up at 2 Calgary schools to screen students and staff who do not have symptoms. They will offer the testing again the week after and may follow up by a third round of screening. We know rapid testing may offer a close to real-time check on the situation in an entire school experiencing an outbreak. The pilot will evaluate the benefits of using these tests to reduce the risk of transmission in schools. That is by quickly identifying those who may have COVID-19 but do not have symptoms. We are hoping to learn if this type of testing would be an effective tool to manage outbreaks. We also need to keep in mind that we are one of the first provinces to run such a trial on-site at schools and offer testing to the entire school population during the school day. This will make it easy for students and staff to get tested with little disruption to the school day as possible. We expect to find out if there will be more uptake if tests are done at school and if it will work well. We also want to determine if rolling out these screening tests on-site is practical in a school environment. That's why we are starting the pilot in only 2 schools in the same city. We will examine the results of the first 3 weeks and any challenges that may arise. We need to learn from this trial experience and take into consideration the feedback from parents, students, and staff, and from the 2 school boards, Calgary Board of Education and the Calgary Catholic School District. This will inform how we can move forward and if we will be able to expand testing to other schools and regions. This pilot is part of our commitment to safely continue in-person learning. Every day a student is able to attend school in person is a win during this pandemic. I'd like to thank all the teachers, principals, and all school staff for their hard work to provide as near normal a learning situation as possible during this pandemic. And I look forward to seeing the results of this pilot. Thank you.
Thank you very much, everyone, and very proud to join the Minister of Education in today's announcement. But before I begin, I want to note that today is the day of remembrance of those that we've lost due to the COVID-19 pandemic. And as of March 9th, 1,928 Albertans have died in the pandemic, and that includes 5 staff in our continuing care facilities. And as I said earlier today in the House, their loved ones will hold each of them in their hearts. And as a government, we will honor them by working to protect Albertans and to strengthen our continuing care system and our health system here in Alberta as a whole. So I'm very proud today to announce another step in doing just that. We're working to protect Albertans by deploying almost 1 million tests to help reduce the spread of COVID-19. Now, throughout this pandemic, Alberta has had the most dynamic testing program in the country. We rapidly expanded testing capacity when this virus first arrived in Alberta. In the months since, we've continued to adapt and we've continued to improve. We were the first province to expand testing to asymptomatic Albertans. We were the first to bring community pharmacies on board to deliver testing. And our border pilot program helped thousands of travelers to safely leave quarantine early while enabling the most robust screening program for variants in the country. And now, over the past few months, rapid testing has become an important part of our COVID-19 response. It's a valuable screening tool that we use to identify potential cases earlier. A positive result on a rapid test still needs to be confirmed with the PCR diagnostic test, but rapid tests mean that we can find more people infected with COVID sooner, even when they don't have symptoms. And so we can get them into isolation earlier and sooner, and to reduce the spread of the virus in our community. We know that we can't identify every case of COVID because many people don't show symptoms, so they don't know to get tested. That's been one of the challenges of the pandemic from the start. Rapid testing helps to solve this difficulty in settings where the virus poses an additional risk. Results from these rapid tests can be available in as little as 15 minutes, less than the time it takes as an example, just less than the time it takes to cook frozen pizza. And they're another tool that we're using to prevent spread and keep Albertans safe. And that's why I'm excited to announce that we're deploying 924,000 rapid tests to protect workers, to protect students, and to protect vulnerable Albertans. Now, every long-term care, designated supportive living, and hospice site in Alberta, and that's 366 of them, has now received rapid tests. Rapid testing programs now up and running in many of these facilities, and the rest are expected to start in the coming days. And we know that many other facilities would benefit from rapid testing as well, like seniors' lodges and other supportive living settings. These facilities are being offered tests, and health officials have already started viewing the applications. We expect to ship thousands of tests to these other seniors' accommodations during the next few weeks. And rapid tests can also benefit workers in a number of occupations. So we're deploying more than 500,000 rapid tests to support screening for employees. And that includes 325,000 to the oil and gas sector. It includes 100,000 to the school pilot program that Minister LaGrange just announced. And it includes 76,000 to WestJet and another 56,000 tests to support screening programs to protect workers in banking, telecommunications, and transportation. Now, rapid tests will be used at Cargill's High River facility over the next several months, and discussions are also underway to provide tests to other meat processing plants as well. AHS has also deployed over 100,000 tests to assessment centers, rural and remote hospital labs, shelters, and other settings throughout the province. And this includes mobile testing that is helping with the response to the outbreak at the Oleomel plant in Red Deer. Now, we know that many other employers and service providers could benefit from testing, rapid testing that is, and so we're working to further expand this program. And I'm looking forward to giving another update in the coming days. Now, we promised to protect lives, and we promised to protect livelihoods, and we promised that all the resources needed to protect Albertans in the pandemic would be there. So we're delivering on these promises, and we're getting through this pandemic. And thank you very much. I'd now like to invite Dr. Hinshaw to provide today's COVID-19 update.
Thank you, Minister, and good afternoon, everyone. Before we begin today's update, I would like to address concerns around reports from Europe where cases of blood clots have been reported in a small number of people after receiving some particular batches of AstraZeneca vaccine. Blood clots happen in the general population for many different reasons, and there is currently no indication that vaccination has caused these events. European countries that have paused use of these batches of vaccine have taken these actions out of an abundance of caution while they investigate. It is important to note that these are extremely rare events in an area that is using a lot of vaccine. It's also important to note that more than 11 million doses of AstraZeneca vaccine have been given in the United Kingdom, with no indication that blood clots have happened more often than in the general population. I want to assure everyone that the current doses of Covishield AstraZeneca vaccine offered in Alberta have not been linked to these issues. We are currently using Covishield, the brand name of a vaccine produced by the Serum Institute of India that is considered equivalent to AstraZeneca by Health Canada. Health Canada authorized these vaccines after independent and thorough scientific reviews for safety, efficacy, and quality, and Canada has a robust surveillance system in place to detect rare occurrences following vaccination. Canadians can feel confident that the review process for each vaccine was rigorous. They can trust that there are systems in place to continue monitoring the safety and efficacy of COVID-19 vaccines after authorization. Alberta has a strong adverse event surveillance system where any unfavorable health occurrence following immunization that can't be explained must be reported. If there are any indications of potential safety concerns with vaccines used in Alberta, further investigation would be done by Alberta Health. We will continue to monitor this situation over the coming weeks and provide updates as more information becomes available. But the bottom line is that there is no current evidence that the vaccine is causing the reported blood clots, and we are not using the same batches of vaccine as were used in Europe. I encourage everyone to book an appointment for the vaccine, whichever type is offered, when they are eligible. As of 2:30 this afternoon, more than 23,000 Albertans have signed up for their Covishield AstraZeneca vaccine. We continue to encourage Albertans born in 1957 or 1958, and First Nations, Métis, and Inuit people born in 1972 or 1973 to book their appointments. Based on expected available supply, we will be expanding the eligibility by 2 years, starting tomorrow at 8 o'clock. Starting tomorrow, Albertans born in 1957, 1958, 1959, and 1960 will all be able to book appointments online or by calling 811. And First Nations, Métis, and Inuit people born in 1972, 1973, 1974, and 1975 can all book by calling 811. Turning to today's update, we have administered more than 317,500 doses of vaccine in our province, with more than 91,000 Albertans fully immunized. Over the last 24 hours, we have identified 364 new cases of COVID-19 and completed about 10,200 tests. Our current positivity rate is about 4%. We have identified 41 additional cases of variants of concern, bringing our total to 775. Looking to schools, there are currently active alerts or outbreaks in 256 schools, or about 11% of schools in the province. These schools have a combined total of 1,017 cases since January 11th. There are 259 people in hospital, including 38 admitted to the ICU. Sadly, 5 new deaths were reported to Alberta Health in the last 24 hours. Every death represents a person who is loved by family and friends and who will be mourned. Today is a national day of observance to commemorate all those who died due to COVID-19, a time to remember the many people we have lost, and a reminder that we must continue to do all we can to keep each other safe. There have been over 1,900 deaths in Alberta, over 22,000 deaths in Canada, and more than 2.6 million lives lost worldwide. My deepest condolences go to everyone who is grieving and to everyone who has had to deal with loss during this challenging time. Today's announcement about the expansion of rapid testing in the province is an important step forward, not just today, but in the weeks and months to come. This adds to the protections to prevent more lives lost. A year into the pandemic, we have many tools, including rapid testing, to use in our fight against COVID-19. But it is important to remember that we must use the right tool for the right job. I'm as guilty as anyone of using whatever tool happens to be at hand if I need to hammer on something, but other tools don't really do the right job and can sometimes even cause damage. When using any tool, whether in home improvement or fighting this virus, we must understand and respect what that tool can and cannot do. Rapid testing is very helpful when used for frequent testing in a particular population over time. This allows it to function as a red light test. What I mean by that is it can be used to ensure people who test positive get a red light stop signal and don't enter a particular workplace or community. Unfortunately, it does not work as a green light test, meaning that a negative test is not a go-ahead to do any kind of activity, because the rapid test isn't as sensitive as some of the other types of tests we use. With a rapid test, it's possible for someone to test negative and then potentially be infectious within that same day. This underscores how important it is to remember how rapid tests work and how they don't, so we can use them to improve safety and not put safety at risk by providing a false sense of security. Rapid testing adds to current measures, but does not replace them. I know some Albertans may wonder whether we will still need all this testing as vaccines become more widely available and more people are immunized. The answer is absolutely yes in the short term, as we look for evidence on how well the vaccines prevent people from getting mild or asymptomatic illness, and understand more about the potential for a vaccinated person to pass a virus on to others. Testing will continue to be an important tool in our fight against the virus, especially as Albertans will be getting immunized at different times, depending on their eligibility, and because it takes 2 to 3 weeks following immunization to reach that level of protection. We need to keep using the right tools, layering these approaches together to keep our communities safe as we continue to roll out our immunization program. Thank you, and we're happy to take questions.
Thanks, Dr. Hinshaw. A reminder that Minister LaGrange is with us if there are questions for her, as well as for Dr. Hinshaw or Minister Shandro. We'll ask you to limit it to one question and one follow-up. So, operator, first question, please.
Thank you. The first question is from Carlisle Fazette, CTV. Please go ahead.
Hi, a question for Dr. John, if the health minister wants to jump in as well on this, by all means. When issues like this come up with the AstraZeneca vaccine, across the pond, there's no evidence at this point that there's any connection to these blood clots. I'm sure that there is still a level of anxiety for people hesitant in getting a vaccine, that this may further entrench them in their beliefs when things like this happen. What's your message to those people, and how are you planning for possible future issues that have to be dealt with?
We take vaccine safety extremely seriously, and we closely monitor any reported events after immunization that are concerning. And when events like this happen, it demonstrates how seriously we take vaccine safety. Because again, countries that have seen the linkages of these small number of events to the particular batches of vaccine have, out of an abundance of caution, paused while they do that investigation, while they look into those particular incidents and determine whether or not there were other factors that are more likely to have caused those outcomes. And so again, this is actually proof that we take this seriously, we report on it, we're transparent, and it's also important to remember that COVID-19 infection comes with a significant risk for severe outcomes. And so choosing a vaccine is choosing to be protected against those severe outcomes of infection. And again, making sure that people know that we continue to monitor, we continue to report when we do see these events, and that we will always give the public the information that we have when there are safety signals that are reported, so they can make the best decisions.
Thank you, and that's a fantastic answer. The only thing I would add is also as a message to those people is that, as Dr. Hinshaw said, the immense amount of monitoring, the approval processes that are required for a vaccine to be approved with Health Canada, vaccines are safe. Vaccines are effective. And the reason to get your vaccine isn't even necessarily for you. The reason to get vaccines is to protect the vulnerable people around you. Whether it's someone who's very young or whether it's somebody who's maybe older and more vulnerable for other reasons, we get vaccines to protect the vulnerable people around us.
Thanks, Minister. Follow-up?
Actually, I'm good. You can go on to the next reporter. Thank you.
Thanks.
There's a first. Thanks.
Thank you. Next question is from James Keller, Globe and Mail.
Hi there. A question for Dr. Hinshaw. In a Facebook Live Q&A last night, the Premier said that people will be given the option to choose which vaccine they get, either because they've got moral concerns or because they just believe that one might be more effective than the others. So how exactly will that work? And what do you think of concerns that allowing people to effectively shop around for vaccines could slow down the rollout if people decide to wait for the one that they want?
We are currently offering that exact choice, as was mentioned, with respect to people able to receive the AstraZeneca vaccine at this time or wait until they're eligible to receive the Moderna or Pfizer vaccines. With respect to any future vaccines, it's going to be important to work out those details once we have the additional information about when those vaccines will arrive, in what quantities. So I won't be able to speculate at this time because, again, we simply don't have that information about when we're going to be receiving different types of vaccines and what quantities they'll come in, and so more information would be available at that time.
Thanks. Follow-up, James?
Sure, yeah. So the Premier said that when he's up for his shot, he's expecting to have the choice between Moderna, Pfizer, AstraZeneca, Johnson & Johnson, and really to pick any of the available vaccines that are around at that time. And he also said that he's directed health officials to make sure that happens. So is that not your understanding of the current plan?
Again, I want to be really clear that we are offering that choice right now. And so individuals can choose to get AstraZeneca through that current booking system, or they can choose to get the Pfizer and Moderna. And the specific details of what kinds of choice might be available once we have multiple types of vaccine in the system, those details need to be worked out when we know exactly the timing and quantities that will arrive. And so again, I can't speculate on what those processes would be at this time because, again, we simply don't know when those other vaccines will be arriving. What I would tell all Albertans is that the vaccines that we have available all protect against severe outcomes. And so it's important for Albertans to take that into account when they're making the decisions about which vaccine they take, because each one that we have available right now is a benefit to that person who takes it, and as Minister Shandro has mentioned, can help protect others around them.
Great. Thanks, Dr. Hinshaw. Next question.
Thank you. The next question is Julia Wong, Global News.
Hi, this question is for Minister LaGrange and potentially Dr. Hinshaw. How come it's taken so long to get to this point of a pilot project of rapid tests, considering teachers have been calling on this for a while, including the start of the school year? And which two Calgary schools are included?
So, while Mr. LaGrange comes to the microphone and is able to take off her mask, I'll just start off by saying that a big part of the problem in being able to use rapid tests for screening was because for a very significantly long period of time, Health Canada was, and they still are, advising against the use of rapid tests for a screening purpose. And now the federal government is permitting the off-label use, as they call it, of the rapid test for a screening situation. It gives us the opportunity to unroll the rapid testing program in a much wider scope, other than the acute care, rural remote acute care, continuing care, and other congregate situations like the drop-in center in Calgary, where we had rapid tests being used for people who are symptomatic. Again, it's still being recommended against being used for diagnosis for people who are asymptomatic, but we had recently received the go-ahead from the federal government to use the rapid tests, not for diagnosing someone who's asymptomatic, but using it from a screening purpose. And so that's allowed us to be able to recently develop these programs for rapid testing screening in various employment situations, which I announced, and the school pilot that Minister LaGrange mentioned. Minister.
Thank you, Minister Shandro, and great answer. We've worked very closely with Alberta Health and the ministry, Minister Shandro's ministry, to when this was available, to make it as available to our schools as quickly as possible. And so the schools that will be chosen between Alberta Education, Alberta Health, and of course the school divisions, and they will be announced next week.
Great. Thanks for that. Follow-up?
Yes, just hoping to get a few more details on logistics. Will this pilot be mandatory? What happens if people don't want to participate? And how exactly will this run? Does everyone need to wait for that negative result before they even go inside the school?
The logistics are that the schools will notify parents and staff that they will be taking part in the pilot. They will have to provide consent forms to both the staff and to the parents. So parents will be aware very early on, early next week, that they will be taking part in the pilot. The actual testing will take place later in the week. And if there is an actual positive test, then the schools will implement the protocols that are in place right now when a student is confirmed to be sick at school, and we'll follow from there.
Okay, thanks, Minister. We'll go to the next one.
Thank you. The next question is from Lucy Edwardson, CBC.
Hi, Minister. Just wondering, how will you guys go about making the decision to pick which schools with outbreaks? And are you going to be focusing on a certain age group?
Again, we're going to work really closely with the school boards. They will ultimately provide their recommendations to my department and to Minister Chandro's department. And between those consultations, the schools will be chosen. The only requirement is that there is an actual outbreak in the school.
Thanks. Did you have a follow-up?
Yes. Just wondering, this is reading the release. It says that students will have to get a permission slip signed by their parent. How are you guys planning to know if a school will have enough of a community or enough of an uptake to participate in this sort of program before announcing it at that school? Have you guys been in conversations, or have school boards started conversations with any specific school communities?
Well, my department's been in consultation with the school boards, and what we have determined is that early next week, the schools that are chosen, dependent, of course, on there being an outbreak in that school, that after those schools are chosen, that they will then contact their parents. If we do not get a good uptake from the parents or from the staff members, then certainly we will look to choose another school. But there is a little bit of time available for us to review that information and then go to another school if, in fact, we do not see that the parents or staff are willing to take part. So it is strictly a voluntary program.
Thanks, Minister. We'll go to the next one.
Thank you. Elise Stolte, Edmonton Journal.
Hi, Dr. Hinshaw. This is a question for Dr. Hinshaw, and my questions follow my line of questioning yesterday. I understand Alberta Health used to fund an immunization outreach team to reach those who are homebound or leery of vaccines. That would cost money, but I'm guessing less than a couple patients in the ICU. My question is Alberta Health planning to reinstate the immunization outreach team? If so, when, for what target population, and what is the budget?
I'm afraid I don't have detailed answers to the question about immunization outreach teams. I can tell you that Alberta Health Services has been providing immunization through outreach teams since the since we received vaccines that we had the ability to transport away from the receiving location. So you may recall in early December, we weren't able to move vaccines from the site that they were shipped to because of stability issues, but further monitoring determined that we could move those and transport them off-site. And so there are outreach teams that have been working since that time to offer vaccine in various locations. Any additional details about the specifics of those sites, exactly what the budget is, those kinds of things I'd have to provide by working with our team offline.
Thanks. Follow-up, Elise?
Yeah, thanks for that detail. I appreciate that update. For my follow-up, I spoke with one of the partners on your COVID care team. They're happy to be involved in helping people in their community who test positive, but they say there have been no plans yet communicated to them to help with the vaccine rollout. In addition, they have not been able to access the race-based data, that COVID-19 data that Alberta Health collected, so as to be able to better describe the extent of the problem that they face. Can you just give a bit more detail on what your plans are to partner specifically with Black community leaders to address the fear and mistrust that's driving vaccine hesitancy?
Thank you for that. And I'm sorry about that disconnect. I was informed by the team that's been working with those community tables with the COVID care teams that they have been speaking about immunization and about identifying barriers such as challenges with transportation. And I have been speaking with them about how we can expand or enhance the work that's already been done. So I'm concerned about the fact that we're not able, or it sounds like that information hasn't been reaching everyone. So again, appreciate you bringing this to my attention, and I'll continue those conversations with that COVID care team lead that I've been speaking with to make sure that we are providing the information that's needed and working with those community leaders who are best positioned to be able to liaise with their community members and help us understand what those barriers might be. So again, I have been told that that has been happening, but we'll make sure that we continue to enhance that.
All right, thanks, Dr. Hinshaw. I think we'll wrap it up there. Thanks very much, Minister LaGrange, Minister Chandra, Dr. Hinshaw. That's all for now. Everyone, have a safe night.